Good afternoon, everyone. I'm glad to see we have some people coming in already. My name is Sharinda Williams Simmons, and I am the communications lead for the National Center for Primary Care at Morehouse School of Medicine in Atlanta, Georgia. And on behalf of our HIT department and Highbridge Solutions, we would like to welcome you to MIPS 101, Addressing Quality Measures through the Annual Wellness Visit webinar. And I'm going to turn over the presentation to Jacquelyn, who is a representative of Highbridge Solutions and our HIT division.
Hey, thank you, Sharinda, and thank you everyone for participating today in our webinar. I'm really excited about the topic and our guest presenters today, so I'm looking forward to a great webinar. Just want to give everyone, hello again, my name is Jacquelyn, and I am the Associate Director here at Highbridge Solutions. Most of you know who we are. We're formerly Georgia High Tech, but basically we are Georgia's Health IT Center, assisting clinicians across the state of Georgia to promote interoperability through the successful use of EHR technology. We partner with various healthcare systems across the state and many community and professional partners. We're located at Morehouse School of Medicine, National Center for Primary Care. Our Executive Director is Carmen Hughes, and our Medical Executive Director is Dr. Dominic Mack. So now I want to introduce our presenters today. So we're very excited to have Ms. Jacquelyn Burton, who is the Training Education Lead and supports the Quality Payment Program for Small Underserved Rural Contract, providing support to practices and working with multiple partners to ensure clinicians have access to APMS and MIPS education. We also have Marianne Ferlazzo, who has served as a subject matter expert in CMS Quality Payment Program and has assisted small practices and large ACOs to successfully comply with the merit-based incentive payment system. Today's webinar's objectives are as follows. We're going to describe workflows to increase efficiency and improve workflows. We're going to understand the annual wellness visit and identify periodic screenings that align with quality measures. And with that said, I would like to turn the presentation over to Ms. Jacquelyn Burton and Marianne Ferlazzo.
Thank you, Yetra. So this is the slide that really gives us an overview of what we will be discussing today. During this webinar, we will determine what the annual wellness visit is, who the beneficiaries are, how to properly schedule an annual wellness visit, various workflows throughout your office, different periodic screenings that align with quality measures, including advanced care planning, and patient documents that are optional but prep patients for their visit, and then we're going to conduct a recap and leave time for Q&A. So let's talk about the annual wellness visit. First, let's talk about what the annual wellness visit is not. It is not a physical exam, nor is it an opportunity to conduct routine labs, collect co-insurance, and co-deductibles from the beneficiary. What the annual wellness visit is a personalized prevention plan that is designed to help prevent disease and disability. It involves provider-to-patient communication. This is where the patient has the opportunity to interact and engage with the provider, and health needs are discussed, which include home safety and health risks, where the clinician or provider is able to ask questions and determine whether or not the patient is safe in their home. This safety can refer to physical safety or psychological risks, such as abuse or injuries, which takes us more into health risks and the optional advanced care planning. So on the annual visit workflow document that everyone should have received, the first item talks about identifying the beneficiaries. So for outreach planning, support staff in the practice can search for Medicare Part B eligible beneficiaries who are due for an initial and annual wellness visit by querying the last 6 months billing codes. Eligibility depends on being covered by Medicare Part B for more than 12 months and not receiving an initial preventative physical care exam within the past 12 months. Additionally, a covered individual may have subsequent annual wellness visits 12 months after the initial annual wellness visit. The CPT code for the initial annual wellness visit is G0438. Use this code in your search and then determine the period of time for eligibility of the visit. Practice staff can conduct pre-visit planning by providing patient education on receiving health maintenance and schedule any necessary referrals. Generate the health maintenance reports prior to the exam. Make sure the beneficiary has not received an annual wellness visit in the past 12 months. Remember, the beneficiary cannot receive their annual wellness visit within the same year as their Welcome to Medicare preventative visit. Using your EHR, you can identify a list of Medicare patients for eligibility and check to determine whether or not they are due for a preventative health service. Remind beneficiaries that the annual wellness visit is at no cost to them and schedule the appointment. Gather basic demographic information from the beneficiary, such as updated address and phone numbers. Subsequent annual wellness visits are conducted post the initial annual wellness visit by 12 months. Use the code G0439 when billing for the subsequent visits. Practice staff can schedule appointments with the beneficiaries as they check out from their initial appointment, and you can follow the same search for the patient population of Medicare-eligible beneficiaries by querying the last 6 months of billing codes. So what are the costs of the annual wellness visit? Again, the patient or beneficiary does not pay for the annual wellness visit. As long as the healthcare provider accepts Medicare Part B, coinsurance and the Part B deductible may apply only if additional tests or services are performed during the same visit. Wellness visit does not include any clinical lab tests, but you may make referrals for such tests as part of the annual wellness visit if appropriate. Medicare may pay for additional services at the time of the annual wellness visit if they are significant, separately identifiable, and medically necessary. A diagnosis code is required, and you can choose any diagnosis code consistent with the beneficiary's exam. Report the additional CPT code with the modifier 25. So it's important to know what is covered during the annual wellness visit. This leads us to the components and workflows. And again, you all should have received the document, and Jacquelyn will go into the details and show you that document later on in the presentation. After the patient arrives and is checked in is when the annual wellness visit begins. The health risk assessment is a personalized prevention plan designed to help prevent disease and disability. This plan should include a review of demographic data, current health status, risk factors related to injury, behavioral risks such as tobacco use, and assessing any urgent health care needs of the beneficiary, such as psychosocial risks like depression. The medical and family history is reviewed, and a list of medication and current service providers, such as DME, home health, Meals on Wheels, or any organization that regularly provides medical care or services to the beneficiary. As part of the visit, the Health Care Risk Assessment, or HRA, can be completed before or as part of a visit with a health professional. This health professional may be a physician or it can be a physician assistant, nurse practitioner, clinical nurse specialist, or other medical professional, such as a health educator, a registered dietitian, nutritional professional, or other licensed practitioner, or a team of medical professionals working under the direct supervision of a physician. Use current staff and enable them to practice at the top of their license and scope. This person will be referred to as the Annual Wellness Visit, or AWV coordinator, as listed on the workflow document. So the screening schedule is similar to a checklist for appropriate preventative services and advanced care planning, and this is all part of the annual wellness visit. This slide shows some preventative care screenings that may be included. The screening schedule, again, is a 5 to 10 year schedule that is age appropriate and is covered Medicare prevention, is made up of covered Medicare preventative services. Establish a written screening schedule for the patient and update your EHR with due dates for the next 5 to 10 years. It is good to be aware of the screening services offered during the wellness exam, and you can get details about coverage for screenings, immunizations, and other preventative services on the Medicare.gov website under Medicare Preventive and Screening Services, and we have included the link to that information at the bottom of this slide. And next slide, and I'm going to turn this presentation over to Jacquelyn.
Thank you, Marianne. So the advanced care planning falls under the Medicare Physician Fee Schedule. The advanced care plan helps Medicare patients make important decisions controlling the type of care they receive and when they receive it. The advanced care planning services should focus on future care decisions that may need to be made, such as how the beneficiary can let others know about care preferences and provide an explanation of advanced directives, which may involve the completion of standard forms. This is a face-to-face conversation between a qualified healthcare professional and a beneficiary to discuss the patient's wishes and preference for medical treatment if he or she were unable to speak or make decisions in the future. Medicare pays for advanced care planning as an optional element of a patient's annual wellness visit. There are no limits on the number of times you can report for advanced care planning for a given patient in a given time period. When billing the service multiple times for a given patient, you'll document the change in the patient's health status and or wishes regarding their end-of-life care. Some people may need advanced care planning multiple times in a year if they are quite ill and or their circumstances change. Others may not need the service at all in a year. Provider and location eligibility. So physicians and non-physician practitioners may bill advanced care planning services if their scope of practice and Medicare benefit category include the services described by the CPT codes. There are no place of service limitations on advanced care planning services. You can appropriately furnish advanced care planning services in a facility and non-facility settings. Advanced care planning services are not limited to a particular physician's specialty. CMS requires no specific diagnosis to bill the advanced care planning codes. You'll report the condition for which you are counseling the patient using the ICD-10 code to reflect an administrative exam or a well exam diagnosis when furnished as part of the Medicare annual wellness visit. The codes listed in this table should be used to file claims for advanced care planning services. So you have two codes, the CPT code 99497 and 99498. 99497, which is the first code, is for the first 30 minutes face-to-face with the patient family member or members, and or a surrogate. And the 99498 is for each additional 30 minutes. And you'll list this separately in addition to code for the primary procedure. These are time-based codes, a base code and an add-on code. So remember, the CPT code descriptors indicate when performed. So completion of an advance directive is not a requirement for billing the service. As you are billing for the advanced care planning, Medicare waives the coinsurance and the Medicare Part B deductible for advanced care planning when it is provided on the same day as a covered annual wellness visit, furnished by the same provider as a covered annual wellness visit, and billed with the modifier 33 preventive services. Voluntary advanced care planning is considered a preventive service when billed with the annual wellness visit on the same day by the same provider. So Medicare waives the deductible and coinsurance for advanced care planning. When the annual wellness visit is medically necessary and billed with advanced care planning, but the annual wellness visit is denied for exceeding the once per year limit, payment can still be made for the advanced care planning. In this case, Medicare applies the deductible and coinsurance to the advanced care planning service. Since payment for an annual wellness visit is limited to only once a year, the deductible and coinsurance for advanced care planning billed with an annual wellness visit can only be waived once a year. The deductible and coinsurance does apply when the advanced care planning is provided outside the covered annual wellness visit. So what happens at subsequent annual wellness visits? You should check the weight and blood pressure, update the previously completed health risk assessment or HRA, medical and family history, and list of current medical providers and suppliers. The healthcare provider should update the written screening schedule, perform a cognitive issue screening, provide health advice and referrals to health education and/or preventive counseling services. At this time, refer to your handout, the annual wellness visit and advanced care planning workflow. It's the document that was sent in the email invite for the meeting, and it looks just like what you see here on the screen. So you will notice the columns at the top show the tasks during the annual wellness visit and advanced care planning, who is responsible, what action needs to occur. So basically, if there are any documents that need to be filled out during that part of the visit, that's what you'll look for. So with depression, you'll see here it's the PHQ-2 or the PHQ-9. How often, and we have provided additional notes for each task, which also includes the CPT, ICD-10 codes, and more importantly, the quality measures associated with each task. So here we're going to take a look at depression or other mood disorder screenings. This shows the tool that you need to use. In the action column, it occurs annually at the annual wellness visit. So that's when you would perform depression or other disorder screenings. And the note section shows the quality measures. There is a comprehensive list of billing and HCP codes in the codes column, and there are 4 quality measures listed here along with the billing codes. So there's 2 on page 2 and 2 on page 3, and you see here the second set of measures are alcohol and tobacco screening. Once you identify the measure, then you would refer to the 2020 clinical quality measure specifications and supporting document spreadsheet to review the measures, description, priority, and collection type that will allow you to meet the submission criteria and successfully perform the measure related to the task. Previously, you would have had less quality measures to choose from. Now that CMS has revised the measures, you're able to cover up to 27 quality measures just by conducting the annual wellness visit and advanced care planning workflow. So recap, are you doing the following? Are you prepping your patients prior to their annual wellness visit? A checklist is helpful to send to patients or discuss with the patient at the time of scheduling. Capturing existing patients who have come to your office for a different reason and scheduling their appointment at that time is a good opportunity to provide them with a checklist and patient education as to what should be brought to the office for the annual wellness visit. The checklist may cover such things as medical and immunization records. Gather as much medical information as you can to make sure nothing is missed. Remember, the HRA questionnaire may be completed prior to the visit. Educate the patient to try to learn as much as you can about their family's health history before their appointment. The information will help the patient and doctor better understand what screenings are needed and what to watch for in the future. Prescription drugs. Have the patient bring a list of any prescription drugs, over-the-counter drugs, vitamins, and supplements that they currently take, how often it's taken, and why, and be sure to have a face-to-face conversation when doing the advanced care planning. Bill and code properly. Know what's involved in the annual wellness visit and use the annual wellness visit and advanced care planning workflow as a cheat sheet or guide. This resource list here is attached to the annual wellness visit workflow document that you received. Please make sure that you refer to these references if you need more information on the annual wellness visit and advanced care planning.
Thank you so much, Jacquelyn and Marianne. That was a great presentation, very informative. And also, we did want to reiterate that if you have any further questions, please put them down in the chat box. And if you wanted to go over some of that information in the slides or request slides, we'll have some contact information for you later. But we did have some announcements. Hybrid Solutions is pleased to provide its members with discounted training, continuing education, and professional development opportunities through 4Med Plus. So what does 4Med Plus offer? Accredited, self-paced, online learning courses geared towards regulatory and compliance topics in the healthcare industry. And also, we just wanted to showcase that we have a coupon code, HighBridge20. I'm going to put that in our chat right now so that you can get 20% off if you want to register for any of those types of resources. And so now we're going to open up the floor to questions and answer. Our first question is, how can I meet PI measures without having a registry for reporting?
Okay, so a couple of things. One is that CMS is hosting a LAN event. I believe the next one will be Thursday, and they will be talking about how to report your PI measures as well as all of the other categories. I would encourage you to go to the qpp.cms.gov website, and there is a wealth of information about promoting interoperability. If you click on MIPS and then promoting interoperability. So halfway down that page, it says, how should I submit data? So there's 3 different submission types for promoting interoperability measures. You can sign in and attest. You can upload a document. If you are using a registry, you'll be able to see those options and what is different about each of them. You can also, if you are using a third-party intermediary, they can sign in and upload on your behalf. And I encourage you to reach out to Hybrid Solutions if you have additional questions about promoting interoperability.
Thank you, Marianne.
Hey, I'd like to jump in. This is Yetra. Also, they can always contact Hybrid Solutions, especially if they're in the Georgia area, and we can actually walk them through that process and what it really looks like as well. So please utilize us as we are contracted with Alliant Health to actually help the providers in the state. Thank you.
Awesome. And we got an email, we got a message from Elizabeth that's asking, when can you bill G0444? It has changed for 2020 and it's a little confusing.
Yeah, I'll have to research that and get back to you on that.
Okay, Elizabeth, so if you would like to, you can email one of these email addresses that you see on the screen so that we can dig a little deeper into your question and get you those answers or lead you in the correct place to get those answers for you. And also, the link for the handout is in your email, but if you email email Hybrid Solutions, we can send you the link to that handout as well, Elizabeth. Thank you for that question. I'm sure some others had some that same question. So the next question is, how can I automate my wellness visits?
I would say to work with your EHR vendor to make sure that you have structured your EHR in a way that if you choose annual wellness visit, all the required screenings and information that you need to collect, you receive an alert for them.
And can you go back to the G code question? So the G code, the G0444 is the annual depression screening, and it is included in the annual wellness visit. So when you're conducting the depression or other mood disorder screening, that's when you can bill that code. And then you can attest to those 4 measures that are listed in the workflows document. And it actually has all of those billing codes listed there in the codes column. So if you have a question about any of those codes, just run a search in the document and look for the column, and then it'll associate with the task. There we go. So you see here the task is depression or other mood disorder screening, and over to the right, the code is there. That is when you can bill with that code. And any of the codes that are listed here, you can bill for if you're performing, the associated descriptor that goes with it.
No. Are there any other questions? Again, we're here to help guide you through this process. This was a highly recommended and asked for presentation. So we're happy to bring this to you all to get more information. And I want to thank our speakers. This was a really good presentation. We learned a lot. Just trying to keep everyone sharp and ready for what's to come and what's going on now. Also, we're going to ask you if you can follow us on Twitter at HIB_solutions, #QPP resources. And our next webinar is the 3rd Tuesday of each month, as always. So it's going to be Tuesday, March 17th, 2020. And again, if you have any other questions, feel free to email us at info@highbridges.org. And thank you. Okay, actually we have where Jacquelyn would like to follow up with the question we had before.
Elizabeth, so you don't need to bill separately with that code because it's actually included with the annual wellness visit. Okay, maybe we need to take this offline because this is getting a little more in depth.
It sounds like it's very good information, though.
Mm-hmm.
So let's just make sure we record this for everyone.
Only for the subsequent work code.
Yeah. Let's make sure we include everyone, Jacquelyn, on the responses and stuff. We'll make sure that we gather the information. But we definitely want to thank you guys for presenting today. We really appreciate on behalf of Hybrid Solutions. So Sharinda, if there are not any other additional questions, let's make sure we get the information and get it out to everyone. We really appreciate it.